So now, is Operation Heal just for surgery?
No, actually, as I said before, it's a perioperative program for
Again,
people who
that
have.
word that I
That's
can't
right.
spell.
Before, during, and after surgery.
Right.
So I work with people who have major surgeries or minor surgeries. Also, people who have procedures. Like I work with women who have IVF procedures or other amniocentesis, things like that. So it could be major or minor surgery or procedures.
Right.
But I also work with people who have treatments like chemotherapy or physical therapy. And with this, you can teach them relaxation skills and kind of augment the therapy and the treatment that the doctor gives.
Right. Now, can you describe to us your mind-body program and how that works?
Yes, well, of course. So I have the program, Operation Heal, and I have this idea that we can look at it right here on this poster that I brought to a conference recently, and the perioperative nurses there really loved it and said, well, where is this program? This is a good program. So I can describe it to you here. And it works also with people who have longer term health issues and they want to be well, right? So over here on this side, you can see it says mind-body healing methods. And it's about mental preparation and the use of natural healing and rapid recovery, and to visualize outcome before it even happens, right, with a mental rehearsal. And you gain confidence and success in your recovery. And you make the mind-body connection, like I did with my husband, with the external stimulation, and then working inside the bone, actually, inside the cave, which turned into the bone.
Right.
And then over here on this side, I have the treatment for healing. So you set goals for health, like I did with the little girl, and you do pre-op mental rehearsal to envision yourself healing rapidly, relaxation skills, self-hypnosis, and then positive self-talk for healing. So that if you say anything negative, you cancel that and substitute positive. And then, of course, there's imagery for physical comfort, which reduces the need for drugs. And here, I have some of the things I work with: general surgeries, procedures for knee injury, back injury, etc. Sports injury is a big thing in my office. I work with a lot of athletes.
Right.
And also integrative support, right, for chemotherapy, immunotherapy, physical therapy, occupational therapy, and the like. So it encompasses everybody's health issues in a way where you can promote healing, take less medication, and it works from the beginning of life all the way to the end of life. I've worked with people on comfort care who want to reduce their the drugs so they can do some life review before they pass on, or very young people like the 9-year-old.
Yeah, it seems like you kind of cover just about everything. I mean, you've got. Is there anything you haven't tackled yet with this, or you're able to apply this pretty much across the board?
You can apply this for every health issue, so it's really amazing. And also, as I said, I work with athletes, and you can help them to perform better, to heal faster. And literally, I've had wrestlers have injuries, they heal, they go to the state championship, and they place. You know, so it's really amazing.
Now, what about people with, say, maybe they've got some mental issues that they're dealing with? Are you able to use Operation Heal for something like that, where it's kind of, you know, in the old brain?
Well, there's always an emotional challenge, right, with illness. There's always something, an emotional basis to it, as I said before. So even something simple, where, like this little girl should have healed from an appendectomy, and she did physically, and everybody's scratching their head and saying, well, how come she didn't heal? What's wrong with her, right?
Yeah.
Sent her off to this anorexia facility. But she didn't have anorexia. That was one thing. She had what I call disordered eating, and it was a result of trauma. So actually, what we did was primary prevention so that she didn't have anorexia in the future.
Right. All right. Well, that's, you know what, that's an interesting point that you make. Again, we're talking with our guest, Dr. Christine Silverstein. She is the director at the Summit Center for Ideal Performance, fertilebodyhypnosis.com or idealperformance.net. Those are her two websites. You can also reach her by phone at 201-760-1600.